Good afternoon, everyone, and I want to thank you for inviting me to talk about popular myths about psychoactive substances. And at the beginning, I would like to tell a few words about me, what I'm doing in this life, and I'm a medical doctor, and I'm a psychiatrist, and I'm still working with the patients that are addicted and are coming to get treatment of addictions. And I'm also working at the Lithuanian University of Health Sciences and teaching students about the topics related to tobacco, alcohol, drugs, control, prevention, treatment, and policy issues. And today I would like to talk about the most popular myths that are related to our risky behavior. And I hope that we will have a good afternoon and good time. So let's start, and I would like to start from the first sentence, which you can hear quite often. And this is mostly communicated by the industry that is selling those products. And what they want to say, and what they are trying to say, that smoking, drinking, and other risky behavior is nothing else, just responsible choice of informed adult consumers. So what they want to say is that we don't have to regulate anything. People are making adult choices, so they know what they do. And one of the explanations for this is that if you would ask people on the street, do they know about the risks? They will probably say that yes, they know the risks, what smoking or drinking can cause, but still they continue their behavior. So that means that they know what is happening, but they want to continue this behavior. But now I would like to move forward, and I would like to show you just a few numbers, which in my point of view is explaining a lot. And first thing what we see when we look to adult people behavior, we see that most of them have started to drink or smoke when they were still children. And what is really worrying, that the age of this risky behavior onset is going earlier and earlier. So people start to drink and smoke being younger and younger. At least this is happening in Lithuania. And we see that, let's say, 2/3 of adults that are smoking today started to smoke during the childhood. And another very interesting figure is that most of them, if we are asking adult smokers, most of them, about 73, in Lithuania we can see the figure of 80%, they are declaring that they want to quit smoking. So let's look to this picture a little bit closer, and just imagine ideally what would happen if everything would work just perfectly. We say that cigarettes is not for children, so just imagine if we would just follow the law and children would be not allowed to buy cigarettes, and that would be real fact, not the dream. And the second thing, if all adults that are declaring the willingness to quit smoking would really do that. So you can imagine how many people you would have still smoking today. And we are probably talking that in the populations like European population, like Lithuanian population, which is quite the same if we talk about the smoking prevalence. Now we have about 1/3 of adult people smoking. And if ideally those 70% of smokers would quit smoking and children would not start smoking. Today we would have about 4.5% of smoking prevalence today. It means that this industry that today declares that this is responsible choice would disappear without any other regulation. So it means that this, what they are trying to communicate, that this responsible decision, that this is responsible decision, is not really true. And we see that most of the people are making choices when they still don't understand the health risks, and when they understand the health risks, they want to quit, but they cannot. In fact, they are getting addiction, and they cannot change their behavior as easy as we would like to. The second picture, what I would like to share with you, is showing how quick the situation can change. And this is a picture of children intoxications. And those are children aged from 9 to 14 in Lithuania that were taken to the hospitals, intoxicated with alcohol. Most of them were in alcohol pre-coma or coma, because simply drunk child would not be taken for the hospital treatment, and doctors would say that it's your problem. If the parents would take a drunk child to the hospital, nobody would take this child for the treatment, except in the cases when you really have child in pre-coma or coma. So you can see the changes that happened in only 6 years. And you can see the absolute numbers that grow up from 19 to 329 cases in 1 year of this age, children that were taken to the hospitals intoxicated with alcohol. So this picture is also illustrating when people are making choices. It means that this is not an adult choice, and those children are very young, and they are already getting intoxications. They are not just starting to drink, but they are really heavily intoxicated. And why those children are so important for the industry? And we see another industry is growing very quickly, and you probably know the energy drinks. And there was a survey published just a year ago that reported that about 70% of energy drinks consumers are children. And this is really a worrying fact that shows that everything starts usually in the childhood. And one of the other myths is that we have like natural willingness to use something psychoactive, and those that are producing something psychoactive are just following people's willingness to do something risky. But in fact, with this substance, especially with those energy drinks, and today you can see how quick electronic cigarettes markets are growing in every country. You can see that adults are almost not using those products. Those are especially very attractive and interesting for children. It means that this demand and supply relationship has the both sides. And you can really work from the both sides, and there is a demand and there is a supply. And if you really supply the market with the product, you can generate demand, and people are finally getting addicted, and they will buy your product if this is really attractively presented for the population. And the producers, they really know this, and they know that if children will not start to use those products quite early, they will probably lose this market. And in this slide you see the picture of Philip Morris document, which says very clearly that it's very important for this industry to know as much as possible about the teenage smoking. And they say that today's teenager is tomorrow's potential regular customer, and that the majority of smokers first begin to smoke while they're still in their teens. So it means that they are studying this child population quite precisely. And another producer that we know is producing quite famous brand of the cigarettes, and you see the pack, the new design of the pack in the upper corner. In the year of 1978, they told that the base of their business is the high school student. And you can see the whole sentence, which says that the success of Newport was a brand of cigarettes sold in the United States, has been fantastic during the past few years, and our profile taken locally shows this brand being purchased by black people, all ages, young adults, usually college age, but the base of our business is the high school student. What industry is trying to say that they have changed. They've changed their behavior. They are not targeting children now. They are good guys now. And they don't want children to start to smoke. But the real behavior is a little bit different. So what we see and what we can say that works as a start, first of all, when we are children, for the industry is not so easy to get us very directly. But they know that they already did their job, and our parents and our teachers can help them. And sometimes adult people, they don't really recognize the risks and the importance of their behavior, what can cause, let's say, changes in children behavior. And you see in one of the pictures a small boy standing with a bottle of champagne. At least this bottle looks like champagne bottle. This is a Lithuanian picture, and this guy won something, and this is a prize that he received. So this is one of the illustrations of social learning theory. And when we are children, we are learning from watching surrounding and our parents, our teachers. And probably you can explain what we can learn when we are 2 years old, when our parents are giving us this non-alcoholic champagne, and we are getting glasses, and we are celebrating. So it means that from the period of life that we don't remember us as a human beings, we are taught to celebrate with drinking. For sure, those drinks are not alcoholic because we are not allowed to drink alcohol. But the behavior itself is very clear. It means that the celebration, all the big events have to be related to alcohol consumption or drinking, as we understand being children. The second picture is showing one of the books that was published in Lithuania. Actually, the original book is Italian book. It was translated into Lithuanian. And this book shows some fairy tale characters making alcohol, and you can see all the distillation process. When from apple cider, those characters are making some strong drinks, And in this book you can read that when you are sick, when you have temperature, when you have flu, it's good to drink those strong drinks in order to get better health. So it's very interesting when you ask parents what they think about that. They say, well, yes, probably this can be a problem. But you know, children are very clever. And it's nothing wrong to show them that, you know, those things are happening in the life, and they have to see the full picture of the life, and life is not a perfect. And for me that was very interesting, and at the beginning I started to think that yes, that actually is true. There is no reason to hide from children that the life is not the perfect one. And they have to know that some people are drinking alcohol and they believe this can help, this can treat some diseases. And at the same time, I believe that in this book there has to be a chapter about Alcoholics Anonymous, and about the groups of those characters that have problems with alcohol use, they have addictions. And I took this book and I was looking to the content of the book, and there was no stories about the problematic alcohol use. And what that means that children are seeing just the one part of the picture. They see this bright side of drinking, which we know, all of us know, and which is usually presented as a reason why people start to drink, because this is just fun, this has a good taste, and that's why we like it, and this is culturally acceptable. And when we see those books, we being adults, we don't really understand what children think. And if you just would go to your childhood, you probably remember that there was a period of time when you believed that the Santa Claus exists, that the fairy tales are real. So in the real terms of psychology, that means magic thinking. So it means that everything that was told in those stories at the beginning of our life was true for us. For sure, when we grow up, we understood that something is not real, but some things, you know, from the history, that all those fairy tales, they have some small part of truth. There was something really happening in people's life that they created stories. Of course, most of the story is not real, but there is something real inside. And usually alcohol and other behavior is real one. Because, you know, the fairies, or I don't know, Santa Claus or those princesses, they don't exist in our real life, but there are things that are very real, like smoking or drinking. And when we grow up, we are let's say we are not looking for those fairy tales more, and we are reading other books. But then industry is trying to catch us when we are teens, and we all know that there is a very important period in our life when we start to look, boys are starting to look to the girls are starting to look to the boys, and the industry knows that very well, and they are starting to use those characters in their advertisement. And you see that this sex image or sexistic pictures are very common, especially in alcohol advertisement. And you see those nice girls, nice boys that have a good time, and they look very happy. And when I'm 13 or 12, I really want to be like those cool guys in the pictures. I want to have a girlfriend that would look nice as in those posters. And this is also connected to drinking. And this is very widely communicated that those people are happy, they are having fun, they have a lot of friends. And those that are not drinking, they are boring. Probably they are just, instead of the parties, they are going to the church, singing songs or reading books. So they are living really boring life. So those social constructs are very widely spread in the world. And then we grow up in the environment that is surrounded by different characters in the movies, television, and probably you can recognize those famous characters that usually are very important also for the teenagers. They love to watch those movies, and you see those characters smoking or drinking. But if I would ask you, do you really believe that those characters are smokers or drinkers in the real life? Nobody can answer this. We don't know. But you know, when you are a child, you don't have such a questions. You partially believe that those people in the movies are very close to the reality. And sometimes we think that those people smoking in the movies are smokers in the real life, but that's not true. If you see somebody smoking in a television, especially in the cinema, it usually means that somebody have paid for this. And industry knows for sure that direct advertisement is not everything, but characters, popular characters, are very important too. So how it develops when we become a students, we become somehow free of our parents that usually are talking that drinking or smoking is not very good thing in our life. We became somehow free, and we start to develop our skills and move forward with our behavior that we started being at the high school. And you all know about the student parties that people are making fun. And there are countries that have a lot of problems, especially United Kingdom. You can see during the weekends many young people drunk on the streets. And there are other countries like Denmark that have a lot of problems with children drinking too. So this is developing, but this can be also explained. This can be also explained by the willingness of producers to participate in our life. And I don't know how many of you have at least once participated in the parties that were organized by alcohol producers, like Carlsberg parties, Absolute parties. And if somebody would propose you to go to sober party, probably I would see smiles on your faces. And you probably would say that what interesting I can find in those sober parties without alcohol, and this is not really possible. But I can say that in the countries that have tried to do sober parties for young people, they have a success. And in Lithuania we have also those sober parties, they call them varom. And at the beginning there was just a very few people, very enthusiastic, trying to make some sober, fresh parties for people that want to have fun, spend their time without drinking. And now they have like 2,000 people in one place when they have this party. And this is a problem to get enough big room for all people that want to go in to do so. So it means that young people, they are not bad at all. They want to have fun. But if industry is the only one that propose their model of having fun, we are finally in the big problems. The second myth is that we can learn to drink responsibly. Or maybe this is not the myth. Maybe we can really learn to drink responsibly. And I want to show you just one picture that, in my point of view, illustrates the best. Is that really true that we can learn to drink responsibly? Because all of you that are studying anything, it doesn't matter what, medicine, technologies, all of you know that the results or outcomes of the studies are directly related to intensiveness and time of the studies. It means that if you are studying more intensively and spend for that more time, you are more successful. Okay, now let's just imagine what kind of results we can get from learning to drink alcohol. This logic doesn't work. Because if you would start to learn more intensively and expand your time when you drink, you will get worse results. You will get more and more problems. And as earlier you start, as more problems you have. And this graph shows that those children that start to drink alcohol being 14 or younger, they have almost 6 or 7 times higher risk to become addicted than those that are starting to drink being 21. And there are some parents that still believe that they can teach their children to drink. They are bringing alcohol themselves to children when they celebrate their birthdays or whatever. And they still believe that they can teach children to drink responsibly. But in fact, there is no possibility to teach to use psychoactive substance responsibly, because those of you that know what addiction means, you know that when you start to use something regularly, you will need to increase the doses. That means that the tolerance will grow up, and you will need bigger doses to get the same effect. So some of our parents, they really believe that they can teach us, but in fact I would like to show you what kind of relations we have in the families that have problems with psychoactive substance use. And you see their data also coming from Lithuania, and you see non-smoking mothers and smoking mothers. And here in this you see their sons, they have tried smoking, and you see in the group of non-smoking mothers, the percentage of sons that have tried to smoke is about 20, and in the group of smoking mothers, this percentage is already almost 40. It means that we have twice. So you see what kind of difference we do have in the families with smoking and non-smoking mothers. Quite the same picture you can see in the families with drinking and non-drinking mothers. And in the families that in which mothers are referring that they are seldomly participating in the parties, that they have some drinks, you can see that in this group, children reported that 25% of them have tried alcohol. And if you will take group of mothers that are participating in parties at least once a week, you can see that in this family group, already 51% of children reported that they have tried to use alcohol. So in fact, this shows that it doesn't really matter what we say to our children. Because I really believe that most of the parents are telling that drinking is not a very good thing, that smoking is not a good thing. But the most important thing is what we show to our children. So it means that the most important thing is our own behavior, what we do when we are parents ourselves. And if you would ask parents, would they agree to stop smoking and drinking until their children will become adults, and they will reach at least age of 18 years? So most of them would say that probably they would not agree, because there are others smoking and drinking around, and they don't really recognize themselves as role models. Okay, so let's move to next one. And you know that many people still believe that alcohol or even smoking could be good for our health. And there are reasons to believe, because this graph, at least for medical students and doctors, should be very well known, because this graph shows relative risk to get ischemic heart disease in relation to quantity of alcohol used every day. And you see that this graph shows quite clearly that people that are not using alcohol at all, are total abstainers, have bigger risk than those that are using alcohol moderately, and then those that are using alcohol quite intensively. So looking to this graph and being a doctor, it looks like I have to advise my patients to drink, because then they will have lower risk of ischemic heart disease. And being a doctor, I'm supposed to do that because I really believe that I have to help my patients. And most of the doctors do that. And if you would go to cardiologists, if you would go to other specialists, they will tell you that a glass of wine would probably work as a prevention from this ischemic heart disease. And I cannot say that this graph is not true. This graph is really true. But then I have to ask the question, how do you think, what is this group of people that are not drinking at all? Actually, the question have to be a little bit different. How would you form this group if you would be a researcher? Just imagine that you have to run this kind of research, and you have to select people that would refer this group. How do you think, what kind of people would go to this group? Should they be abstainers for 3 months, 3 years, lifetime abstainers? Which category would be fair to take as non-drinkers? I think that logical answer would be that if we want to see what risk is for non-drinkers, we have to take non-drinkers. The total abstainers, the lifetime abstainers. This is a group of non-drinkers. If you want to see what risk is for former drinkers, you have to take people that are not drinking for at least 12 months. Then you would have a group of former drinkers. So this we don't see in this graph, and we see that people that are not drinking at least for 3-5 years are taken as non-drinkers, and this is not fair because other research showed that most of them are former drinkers. So it means if you are comparing them with moderate drinkers and intensive drinkers, you are simply making a systematic error which is referred in scientific articles, and says that 2 errors were observed: the inclusion of former drinkers and occasional drinkers into abstainers category. And that's not fair to say that people are not that are non-drinkers have higher risk. And look what they found. They said that studies without this error did not show that abstainers are at higher risk of all-cause mortalities and cardiovascular disease mortality. So we have to know that graphs, even if they are real and true, they have to be, let's say, correctly interpreted. And we see also that there are some articles now coming into publicity which says that some data was falsified intentionally, and there is one of the articles that says that that red wine researchers told that they were falsifying data, and we don't know how many of those articles are not really free of any influence. And worries are quite high, because you probably all of you know that especially red wine is usually presented as a very good thing to drink. And you see in this article, especially this group of scientists were affected, that we're talking about the red wine. But when we look to other diseases, we see this J shape, and we see increase in risk of any other diseases related to alcohol use. And being a doctor is unfair to propose to drink any medication that would decrease a risk of one disease and would increase risk of 60 other diseases. And we know that in medicine there is a first and main rule: first, not to harm. And if you cannot help, at least not to harm your patient. So from this side, it's not really fair to advise patients to drink wine or any other kind of alcohol. There is another linkage that we see from our studies, and some of the people say that those people that are drinking, they are more socialized. They are drinking to decrease stress level. But if you would look to this graph, this shows suicide attempts of Lithuanians, and in this those red bars are showing that they have attempted to commit suicide earlier than during last 12 months, and this blue bar is showing those that attempted to commit suicide during last 12 months. And you can see what kind of relation we have here. And you see that those that don't use alcohol, they have much lower risk than those that are using alcohol 4 or more times per week. Which means that alcohol doesn't really solve the problems. And people that are trying to become more relaxed, finally, they are getting more even mental health problems. And you see those numbers are really worrying. And you see the differences between drinking and non-drinking people is like 3 or 4 times. The next myth is that the health specialist always helps and knows better. I want to show you just one example. And most of us do really believe that drinking during pregnancy is a kind of taboo. And most of the people believe that if you do something wrong during pregnancy, that can really harm your baby. It doesn't matter what you do. Is that about smoking or drinking or medicine taking? And most of the mothers, they are trying to do everything the best they know to just have a healthy baby. And we did some research by asking obstetricians and gynecologists about their behavior with their patients. And that was very interesting. We asked them, do they recommend alcohol for their pregnant patients as a mean to relieve unpleasant symptoms, to decrease tonus of uterus, increase blood pressure, and whatever. They have different reasons to advise to take alcohol. So as you see, most of them told that no. Just a very few, like 9%, actually 12%, told that they advise at least sometimes. But then we did some trick which shows that the problems are at a much higher level, because we asked them, do they know other doctors that advise to drink alcohol to their pregnant patients? So it means not me, but somebody else is advising my patients to drink alcohol. And this is very interesting. It's the same like you ask in the classroom, are you smoking? If you ask somebody, are you smoking? Everyone will say no. Do you know a friend in your class that is smoking? Most of them will say yes. They know the friend. So somebody is smoking, but not me. So the same happened with the doctors. They feel ashamed to tell that they advise patients to drink alcohol during pregnancy. But if you ask about other behavior, 44% of them reported that they have patients that reported doctors' advice to drink alcohol during pregnancy. Which means that sometimes doctor is not the best advisor. And that's very worrying, because people are going to the doctor to get a good advice and to become healthier and have a healthy baby. Another question is what usually people say, that, well, we are telling so many facts that are related to health, but that cannot be really true, because if those substances would be so bad, they would probably be illegal already. And it's really strange that we don't really see how big the problem is. And I want to show you only one number. What was calculated, that about 100 million people died from smoking in the 20th century. And this is as many deaths as during the World War I and World War II combined. And people still think that it's just a business. So if you talk about the Second World War, you know that the many countries have done a lot to avoid any kind of this happening in the future. That's why the European Union was created. That's why the NATO was created, and many other organizations, to prevent those deaths and diseases. And when we talk about those risk factors, we see totally opposite picture. And I have only one logic explanation why we don't see those substances in illegal list. It is just historical thing, and money are too big. So it means that those industries are now too powerful and too big to be regulated effectively. And we usually don't see very good effects when we talk about the policy. And sometimes it's strange when we look to our perception of the risk. And sometimes it becomes really fun, because you probably know that in a working place or in any other place, carcinogens are not allowed to be. And if they exist, people cannot stay in this working place longer than few hours. So they have shorter working day, they have special things for the protection to be used. And it's funny that the passive smoking that contains 90 carcinogenic substances itself is not recognized as carcinogen and is not regulated as a carcinogen. And you still see the discussions going publicly when politicians are deciding to stop or not to stop passive smoking at the working places, in the places where other people are sitting, like in the cars or flats, where children and family members are living. And this is very strange, because theoretically we know a lot, but practically it's very complicated to do anything. And it's the same with alcohol. I don't know how many of you knows that this is a group 1 carcinogenic substance. So how way we still can hear from the doctor's advices that the red wine is a good thing after radiotherapy or even chemotherapy for the oncological patients? So it's very strange to hear that from the doctor, but they still believe that red wine contains antioxidants, and it contains antioxidants. And you know the substance called resveratrol, and that was very fun that somebody calculated how many bottles of wine you have to drink in order to get 1 gram of resveratrol, and this is more than 600 bottles of wine. So I don't know if that's so complicated for the pharmacy to create that resveratrol, to synthesize and to get, I don't know, 10, 20 grams for very cheap, and just to sell it and prevent people from this carcinogenic and teratogenic substance. And the last one I want to say by finishing is that some people still believe that to smoke or drink is better than use narcotics, and most of the parents believe that it's better if children are drinking and smoking than taking illegal drugs. But I want to show you just one last picture that shows how alcohol use is related to illegal drug use. And you see that those children that didn't use alcohol, they have few times lower risk to take illegal drugs in the future than those that are taking alcohol. So this comes to the same place, and to the parents' belief that we can teach children to drink. It means that if I am giving bottle to my child, finally I'm getting worse and worse result, and risk that my child will become addicted and will use drugs in the future is getting higher and higher. So that is everything that I wanted to say, and I want to thank you for your patience and my complicated English explanations, and I hope that you found something new in my presentation, and I would be happy to answer any questions. And I see there are some questions, and it can take time to read them. Well, most of the discussions is about the voice that you couldn't hear, at least for the moment. Okay, so I don't see the question, so thank you very much, and have a good afternoon.
So, EMSA Student Scientific Society is very grateful for you for this wonderful presentation, and thank you once again for beating the myths about the health. Thank you very much.
Thank you.